Hello and welcome to another episode of Voices to End Hunger. I'm Minerva Delgado. The Older Americans Act recently turned 60. This landmark piece of legislation has been fundamental in our nation's approach to caring for and promoting the well-being of our nation's seniors, including through vital nutrition programming. On this episode of Voices to End Hunger, I speak with Josh Protas, Chief Advocacy and Policy Officer at Meals on Wheels America, about the OAA, hunger among our nation's seniors, and what the present and future of the OAA looks like. Josh, welcome to the Voices to End Hunger podcast. It's such a pleasure to have you.
Oh, thanks so much, Minerva. It's great to talk with you.
The Older Americans Act recently turned 60, which is the basis for our episode today. But before we talk about the Older Americans Act, or OAA, as we'll refer to it in the rest of the podcast, I'm wondering if you could tell us a bit about senior nutrition, the state of hunger among our older adults in the U.S., and what some of the unique challenges are for serving this population.
Yeah, happy to talk about all of those things. And thanks for the interest in the Older Americans Act and issues impacting older Americans. So food insecurity remains a challenge for older adults. And unfortunately, it's a population that often gets overlooked. I think that is not just in the anti-hunger space, that is writ large in many ways, and not just in policy matters, but across our society. I think family structures have changed, where generations ago we would have grandparents living in the same household as their children and grandchildren, and family units were more cohesive. And the needs of the elderly were taken care of in many ways at a household level, but also by communities, and where you had families that were in the same community for generations, right? So things have shifted. We're a more peripatetic society, so people no longer live as close by to older parents. So the needs sometimes get overlooked because they're not right in front of us all the time. Fortunately, we as a country have invested in programs and structures that respond very effectively to the needs of older adults. And you think back to the New Deal era and the Great Society in particular. And as you noted, we're celebrating this year, actually, just on July 14th was the 60th anniversary of the Older Americans Act. But Medicare is celebrating an anniversary now, 60 years old, and I believe Social Security at 75. There was a lot of foresight in these kind of sweeping federal programs that help to ensure that we're prioritizing the needs of people as they age. So there is a lot of wisdom in the creation of those programs, but needs have changed, and we haven't really kept up as a country in investing to the degree that we need to. And in particular, it's worth noting about the changing demographics with a rapidly aging population. We will soon have more older adults in this country than youth. There are 12,000 people every single day in America who turn 60 years old. And the programs that we have not received the increasing levels of funding that they need in order to keep pace with these growing needs. So in terms of anti-hunger policy, it's really important that there's a greater awareness about the challenges for older adults and an investment in programs that we know that work. I'll say in particular about SNAP, the Supplemental Nutrition Assistance Program, that while SNAP has been a powerful force in addressing food insecurity for older adults, participation by seniors remains stubbornly low. So this is one of the challenges, and it's for a variety of factors. It's because of stigma or some shame, or because of misinformation about the program. Some seniors feel like they don't want to take the benefit away from somebody they think may need it more, when that's not actually not the case. But these perceptions and stereotypes persist, and unfortunately, they lead to low uptake even among people who need the help. Part of this is because of cultural messages too. So we think about all of the negative stereotypes and political discourse that talks about programs like SNAP in really negative, sometimes racially informed ways that is very judgmental. That contributes to a chilling effect where people have negative perceptions of programs and they don't see themselves as part of that program or don't want to associate themselves with that program because of those negative perceptions. And that's certainly part of the picture for older adults, which is really unfortunate.
In my previous career, I worked at food banks and spoke to many seniors who would come to the food pantry and hadn't realized that they may qualify for SNAP or other programs, or just felt like they didn't want to kind of take benefits away from other people, even though it doesn't work that way. But I think also the stigma issue that you mentioned is really a big one, because particularly when we think about when these folks, were kind of coming up, SNAP was food stamps and the vouchers, and had a very negative stigma associated with it, which now that we have an EBT card that looks like a credit card, that stigma has alleviated over the last, decade or two. But I think still for our older residents, that stigma is still very real.
Well, I think we've unfortunately seen, even in recent years, as there have been helpful advances like the EBT card, there's been really negative political discourse around programs. So I think back to one of the recent Farm Bill cycles when there were these stereotypes about people going out and buying lobster with their SNAP benefits. And there was a Fox News special about the surfer dude who was living on his couch and enjoying the high life, buying steak and lobster. And a lot of, I think, intentional efforts to portray SNAP as a quote unquote welfare program, not in a good way, and maligning people who receive help. And if we look at the budget reconciliation bill discourse, I think some of that contributed to negative perceptions, where there were congressional Republicans talking about not cutting benefits, but just making sure we're doing away with waste, fraud, and abuse, and making sure that benefits get to the people who truly need them. Well, the implication is that there are people who don't really need them or who aren't deserving. So what does that mean if we're saying that somebody's part of the undeserving poor? There's a lot of judgment associated with that, and just the rhetoric around it, I think, heightens that stigma.
We'll refer folks to our podcast just from a few weeks ago, Busting SNAP Myths, where we spoke to former recipients who talked about the very difficult decisions they made to use SNAP and why that was important for their families at the time and how that helped them through some very difficult times. So thank you for that. In terms of the state of hunger among our older adults, can you talk a little bit about that and what some of the unique challenges are for serving this community?
Yeah, unfortunately, the state of hunger for older adults is pretty severe. About 15% of older adults experience food insecurity or are at risk of food insecurity. And that's an enormously high number, and it doesn't have to be that way. The underparticipation in available programs certainly is a driver. We know that financial hardship is a contributor. People's retirement funds just aren't going as far as they used to. There are higher costs if people live further away from family supports. All of these things contribute. And then certainly there are particular populations among older adults that face disproportionate challenges. One of the beauties of the Older Americans Act is that services are directed toward older adults who are in the greatest social and economic need. And so there's a real wisdom baked into that to try and meet people where they are and to focus efforts on those who need it the most. And so greatest social need includes things like older adults who live in rural communities where they may not have as easy access to a senior center or to supportive services. It also recognizes those who are not English language speakers, first and foremost, and for communities of color. Recognizing that people have unique circumstances and trying to direct services to help meet those.
So, Josh, now getting into the Older Americans Act itself, how did this piece of legislation originate? How has it evolved over the years? And why is it important to have an entire act dedicated to our older population?
Great questions. So, the Older Americans Act was passed in 1965, and this landmark legislation has really served effectively as the first and primary nationwide program designed to support the dignity, independence, and well-being of older adults. And those terms are really important because they center dignity, independence, and well-being. They work in a coordinated fashion, these different programs that are authorized as part of the OAA, to really help seniors remain in place, live independently at home as long as they're able, to support good health and well-being, to ensure that they can remain safely in their homes, and that they have access to supportive services that may change over time as they age. The Act has been updated over the years. It gets reauthorized about every 5 years. The nutrition program actually was not an original part of the Older Americans Act. That was added in the early 1970s. Although there were Meals on Wheels programs that existed before the Older Americans Act, but that operated independently. In terms of federal funding and federal support, that happened and was integrated into the OAA in the early 1970s. And we've seen as American society has changed, the needs of older adults have changed, that there have been new components and updates to the Act. I can speak most about the nutrition program, and there are three main components to that. There are congregate meals. So these are meals that are served in a congregate setting, oftentimes in senior centers, but they may be in other communal spaces that bring seniors together and that offer programs and services and, importantly, social connections. Then there are home delivered meals and Meals on Wheels. The name Meals on Wheels, I think, is very closely associated with those home delivered meals. I'll note that social connection is a fundamental part of that model as well. So when we talk about home delivered meals, we're not talking about just drop shipping frozen meals on the front porch. This involves volunteers or staff from local community based organizations that have a relationship with the older adult, that they bring them food that is nutritionally geared toward the needs of seniors, and in some cases, medically tailored meals designed around particular medical conditions and nutrition that helps to support good management of that. But they're entering the home. They're eyes and ears on that older adult, and they're that really important moment of human connection that sometimes for a senior may be the only point of human connection over the course of a day or sometimes over the course of many days. And we know that social isolation and loneliness are acute problems. The Attorney General under President Biden declared social isolation and loneliness as an epidemic. And Older Americans Act programs have worked effectively for a long time to try and address these challenges. The other part of the OAA nutrition program is NSIP, NSIP. That's the Nutrition Services Incentive Program. And that is a component to help subsidize the purchase of food, of American produced produce and food products. And it's based on an incentive about the number of meals served. While there are three different parts of the OAA nutrition program, they're pretty integrated. And if we look at the majority of providers, those providers are meeting the needs of seniors where they are. So they're, in most cases, offering both congregate meals and home delivered meals. So Meals on Wheels may be part of a local community based organization's name, but they may also be providing those congregate meals as well. And they're most likely utilizing that NSIP, the Nutrition Services Incentive Program dollars, to help purchase those foods for the meals that they're serving.
I was familiar with Meals on Wheels. Of course, I'm familiar with congregate meals and have been to a number of senior centers and seen really how seniors light up, to be able to socialize with others, see their friends, get a nutritious meal. And of course, Meals on Wheels has combated social isolation for a very long time. But to also understand that this is an economic engine that really helps, our farmers and really feeds the food supply chain is really interesting as well.
I'm glad you used the term economic engine because it really is. So, if we look at the funding for senior nutrition programs, about 37% comes from the federal government through the Older Americans Act. That is a small but powerful investment that helps to unlock state, local, and charitable contributions. So for every dollar invested through OA nutrition programs, we're unlocking $4 more. But those other sources of funding can't fill the gap when the federal contribution is insufficient or potentially faces cuts. And unfortunately, the rising senior population and growing costs have not been matched by a corresponding increase in federal funding. This goes back for a number of years, but we certainly saw need spike during the pandemic, especially for home delivered meals, as senior centers weren't operating, seniors weren't going to congregate sites. So programs flexed to respond to a public health emergency and to really serious challenges that older adults were facing who had exacerbated challenges around social isolation and loneliness. There were fortunately pretty significant boosts in funding during the pandemic. So those pandemic era boosts really helped programs to meet that added need. But that funding has dried up now. It's expired. And the need has not gone back down. In many cases, it's even higher than pandemic era levels. And remarkably and sadly, in fiscal year 2024, we saw a cut to the OAA nutrition program for the first time in more than a decade. And that's despite rapidly growing need, rising costs. And the result is that programs have waiting lists. On your podcast, you may have talked in the past with folks about the special supplemental program of women, infants, and children. And advocates and Congress often rally when there's the prospect of a waiting list for the WIC program and come up with emergency funding to kind of head off that possibility. Senior nutrition programs have had waiting lists for years. 1 in 3 Meals on Wheels programs reports having a wait list right now. Average wait time is 4 months, in some cases 2 years or more, and that's only for programs that keep waiting lists. There are some that don't because either they're not allowed to or they don't want to give false hope to seniors that they know they're just not going to be able to serve. And you think about how devastating that must be to have to tell an older adult who is seeking help that, I'm sorry, you're going to have to be put on a wait list. You may have to wait months before we can provide you the nutritious meals that you need. And by the way, we're not going to be able to provide that human connection to address your isolation and loneliness. There's no reason that should happen. It's not only cruel, but it's also costly because when we can't provide seniors with those basic needs that they need, the nutritious meals, those moments of social connection, we know that they're far more likely to have to turn to help either through emergency room visits or hospitalizations or they're no longer able to remain independently at home and have to go to a nursing home. And all of those institutional settings are much more costly to taxpayers. We could feed a senior and provide them with those moments of social connection and those safety and wellness checks for an entire year for roughly the cost of 1 day in a hospital or 10 days in a nursing home.
Josh, thank you for raising awareness about the fact that some of the Meals on Wheels programs have waiting lists. That's not something that I knew, and I'm sure lots of our listeners are learning this for the first time. And the fact that there is a program that can help seniors stay healthy, stay connected to folks in their community, and stay at home as a preventative measure that's so inexpensive compared to the alternatives, like you said, it's just a shame that it's not fully funded. So I think part of the call to action for us here is to really advocate more to make sure that these programs are fully funded.
Absolutely. Meals on Wheels America has been working very hard to try to get increased funding for the senior nutrition programs. We work very closely with NANASP, the National Association of Nutrition and Aging Service Programs, and have been working on the congressional appropriators and other members of Congress to just raise awareness because I think many folks don't understand about the waiting lists. On the Meals on Wheels America website, we have information about the End the Wait campaign that really aims to raise that public awareness and to call attention to the powerful impact programs make and the unfortunate need for increased funding so that they can reach all who need it. Right now, senior nutrition programs are serving about 2 million seniors, a little more than that. That's between both congregate and home delivered meals. But we estimate that there are at least 2.5 million more seniors who we're not reaching. And so if we think about what the costs are when we're not meeting those needs, about those higher healthcare costs, the higher costs from falls, from social isolation, it's costing our country a lot of money. And we started talking about the budget reconciliation bill, and I think there were many things that were unfortunate about it. And part of that is that while that effort was ostensibly about trying to save our government money, many of those cuts will wind up costing more. They may not get scored by the Congressional Budget Office and count in terms of those budget calculations, but they cost more in terms of long-term healthcare expenses that could have been prevented, in terms of food insecurity that could have been prevented.
So, Josh, I did want to talk to you about, we just went through budget reconciliation. The One Big Beautiful Bill Act was passed, a misnamed bill, if there ever was one. Unfortunately, we know this is going to result in cuts and other changes to SNAP, where states are now, for the first time, going to have to pick up a lot of the costs of that program. Um, as we're thinking about this and the future of the Older Americans Act and the programs related to that, what do you think some of that impact might be?
Well, I think the budget reconciliation bill is going to increase levels of hunger and hardship across the country, and that will include heightened levels of food insecurity, economic challenge, loss of health insurance for older adults. And as a result, we're going to see an even greater demand on Meals on Wheels programs. So, as seniors who maybe had been supported through SNAP and that had helped to address their food security needs, or who had been receiving Medicaid and may lose access to that, their circumstances are going to become a lot more challenging, and they will be turning to available programs that already are under resourced. So the wait lists that Meals on Wheels programs already have that are already unacceptably high are going to grow far more severe. And it means more seniors are going to be forced to do without basic necessities that help them live healthily, safely, and with dignity. I think this is really a retraction of what has been some long-standing commitments of our federal government to fulfill that collective responsibility for taking care of those who are vulnerable, including seniors.
Yeah, I think you're right. It's a grim outlook. We're going to have to look for opportunities to increase support, particularly to older Americans as we move forward. And I know the Older Americans Act has had a history of bipartisan reauthorization and bipartisan support, but it has not been reauthorized for a number of years. Like, what do you think is the reasoning behind this? And how does a failure to reauthorize the legislation impact the work championed by the bill?
So the Older Americans Act reauthorization process actually got very close to being done at the end of 2024. There was a bipartisan bicameral agreement that was attached to a year-end spending package until it was no longer attached to a year-long spending package. It unfortunately got undone, not because of anything having to do with the OAA or many other things that were included in that package, but this concern about kind of a multi-pronged legislative agreement and a year-end spending package that just all fell apart. Unfortunately, we missed that window in the last Congress to get the OAA reauthorization done. The Senate recently reintroduced, a bipartisan group of senators reintroduced essentially that same OAA reauthorization bill. And we're working quietly behind the scenes to try and expeditiously get that over the finish line. There have been periods of time when the OAA has lapsed in authorization. Um, Unlike in the Farm Bill, OAA programs continue on even if there's not a current authorization. But we're living in a strange political environment, and there has been some discussion in the past, recently, about unauthorized programs or programs with lapsed authorizations being more at risk. And so we don't want to take that chance. Look, we know the OAA is incredibly powerful, it's very effective. Um, so there's no reason not to get this reauthorization done. I think to the point that we spoke about before regarding prioritizing the needs of older adults, the OAA reauthorization hasn't been kind of a sexy legislative vehicle, so it hasn't gotten the priority attention that it should. But it does important work. It meets the needs of older adults. Its programs need to be bolstered. And right now we're facing a lot of changes happening at the agency level with significant reorganizations and staff reductions happening at the Department of Health and Human Services, HHS, where OAA programs are centered. Unfortunately, just at the same time that we were celebrating the 60th anniversary of the Older Americans Act, nearly half of the staff of the Administration for Community Living, ACL, which oversees OAA programs, were terminated. And there are a lot of question marks about how programs and grants and evaluation and administration is going to function seamlessly with such a reduced staff.
And I think that that's part of the challenge we're seeing throughout many of the government agencies that have been underfunded, where staff have been significantly slashed, is how do you maintain those systems that have been working well, right, for a long time? Um, so it sounds like there's at least one call to action in there. And I know we have lots of advocates who listen to the podcast. What would you say are, like one or two top line messages that you want folks to hear and to carry to their legislators?
It would be great for more people to prioritize the needs of seniors, to join Meals on Wheels America to help us end the wait. And the most fundamental part of that is increasing funding for OAA nutrition programs. So we're right in the heart of appropriation season, as Congress is making decisions about funding for fiscal year 2026. So it's a fantastic time for advocates to reach out to members of Congress, to invite them to go visit their local Meals on Wheels program. If the member, him or herself, can't make it, having their staff there to educate them to see firsthand the power of these programs and why a significant increase in funding is necessary. We know this is a very challenging economic environment, fiscal environment for Congress, and while we know that more than doubling of current funding isn't going to happen, that's really what's necessary in order for programs to serve all in need. So there are difficult choices that Congress is going to have to make, but making sure that seniors who are vulnerable and homebound can get the nutritious meals they need and the moments of social connection and the ability to remain at home safely, independently, and to enjoy better health, that shouldn't be a difficult choice. So Congress has to take at least a small step toward increasing funding to begin the process of closing the gap. We know we're not going to get there and entirely close that gap now, but let's take steps in the right direction.
Thank you. And I think advocates can get behind the fact that this is a common sense choice when you think about what the stakes are for older Americans and what the costs of inaction are. So we know at the Alliance to End Hunger we'll be joining you in those calls and supporting that call as well. Now I'd like to just pivot a little bit to take advantage of your unique position with the Alliance to End Hunger. So you happen to chair the domestic policy subcommittee of the advocacy committee of the Alliance to End Hunger. And so you're a key partner with us. You yourself have been a partner with the Alliance for a long time, going back to your days at Mazone, a Jewish Response to Hunger. And we so appreciate your leadership in this space. We've covered a lot of the bad news, unfortunately, in terms of what we're facing in this very difficult funding environment, but also with the attacks on food and nutrition programs overall in this administration. What are you looking forward to most in the next few months in terms of our domestic priorities at the Alliance to End Hunger? Are there potential areas where advocates can be effective?
Well, first of all, thank you, Minerva. It's really been my privilege to be connected to the Alliance to End Hunger personally and organizationally, both in my previous role at Mazone and now at Meals on Wheels America. And I think the unique role the Alliance plays in bringing together different sectors to join together in advocacy efforts to address hunger is so important. Uh, I've been encouraged that the anti-hunger community, while we've faced a lot of challenges, remains resolved, and things could be a lot worse. As bad as the budget reconciliation package was, there were some proposals that got headed off. So there had been a proposal to eliminate the social services block grant. That's a key source of funding for many Meals on Wheels programs and other social services providers. We were able to keep that completely out of the reconciliation bill. There were even deeper cuts to SNAP and to Medicaid that potentially we could have faced. So advocacy makes a difference, even if we're not getting all of the wins that we'd like to see, and we're not, unfortunately, making the forward progress we'd like to make. We know our efforts make a difference in at least helping to prevent worse legislation from being enacted. And in turn, that makes a difference in the lives of people who benefit from these programs. And one trend I've seen in recent years, and the Alliance has certainly contributed to this, and it's something that Meals on Wheels prioritizes as well, is lifting up the voices of those who are impacted by these policy decisions and centering the individuals and people with lived experience, people who know these programs, they know the benefit of these programs, and making sure that not only their voices are heard, but that they're reflected in the legislation that ultimately happens, because policy shouldn't be done in the abstract. It's not just about the dollar figures and the numbers of people who are impacted, but it's a recognition that those numbers of people impacted reflect numbers of individual stories. It's been encouraging to see the advocacy community really centering stories, centering people in our efforts. And I think it becomes more difficult to make cuts when we recognize the humanity of those who are hurt. And so as we gear up for the next battles ahead, and there are next battles ahead, I think taking comfort in knowing the importance of the work that we're doing, of being in community with other partners who share values and are engaged with communities that we serve, and knowing the difference that we can make. That gives me hope. I'm not optimistic that we're going to make sweeping changes all at once, but that's not the way advocacy works. It's pretty rare that you get those moments where tremendous forward progress happens suddenly. It's a marathon, and we remain committed to it.
Thank you. You mentioned something earlier that I think is really important for us all to remember as we talk about the programs that we're championing, which is the dignity of the folks who use these programs, that we really need to center that. And I think that it's a great note to just wrap up our podcast in remembering that when we're talking about folks who are food insecure, they're struggling with so many different things in their lives, but this is not something they need to struggle with. And we can put programs together that help retain their dignity, help keep them connected to community, like the Meals on Wheels programs, like the various senior nutrition programs, and just really want to leave folks on a note where we're thinking about the importance of those people in your community who need these services and the fact that we all need to speak up about that.
Absolutely. When I had the chance to join the team at Meals on Wheels America, I was particularly excited because my grandmother, Ruth Protas of blessed memory, received help from Meals on Wheels for many years. She was blind for her entire adult life, and Meals on Wheels was a lifeline that helped to make sure she got good nutrition, but also those social connections. And the volunteers who'd bring meals were like part of the family, and an important part of her life. And I think if we think about these programs in a very personal way and think about our grandparents, our parents, about older adults in our lives who may be touched by these programs and what a difference it makes, that's a good way to ground ourselves in the difference that these programs make and why they're so important. And I hope that for policymakers who are making these important decisions, they can center that personal connection and recognize why policy matters. And we've got to do better as a country in addressing these needs. As Jim McGovern likes to point out, hunger is a political choice. You know, we have the food, we have the resources. What's missing is the political will to prioritize this. And I hope that we continue to make progress in bolstering that political will.
Thank you.
Thank you.
That was Josh Protas of Meals on Wheels America. If you'd like to learn more about senior hunger, Meals on Wheels America, or how you can get involved, please visit mealsonwheelsamerica.org. Thank you for joining us for today's episode of Voices to End Hunger. Please feel free to write us any comments or questions at podcast@alliancetoendhunger.org or through any of our social media channels. And of course, don't forget to subscribe. Today's episode was produced and edited by Nate McGrath, and I'm your host, Minerva Delgado. Have a great day.